Welcome. Hi, I'm Mikki, and this is Mikkipedia, where I sit down and chat to doctors, professors, athletes, practitioners, and experts in their fields related to health, nutrition, fitness, and well-being. And I'm delighted that you're here. Good morning, everyone. This week on the podcast, I speak to naturopath and women's health expert Alexandra Middleton about endometriosis. We discuss the etiology of the disease, what places a woman at increased risk, what factors outside of diet and lifestyle that impact on symptoms, and the diet and lifestyle treatments that can help a woman with endometriosis, including supplements that Alex regularly uses in her clinic. We also discuss the environmental factors that impact on the progression of endometriosis. Alex shares her own journey as to how she got interested in the field and what led her to become one of the foremost experts in both women's health and, of course, endometriosis. Alexandra Middleton is an experienced natural medicine clinician with over 10 years of experience in helping women optimize their hormones and reproductive health. And her mission is to show women with endometriosis how to get their quality of life back through the combined power of natural, environmental, and conventional medicine. Alex's approach is grounded in the principles of both naturopathic and evidence-based medicine. She is passionate about incorporating the latest research into her clinical practice and recently co-authored a 2021 paper published in the peer-reviewed Journal of Alternative and Complementary Medicine. Alex also works extensively with the medical community because she believes collaboration is the best way to ensure positive outcomes for her clients. Working closely with specialists in gynecology, endocrinology, fertility and general practice, she uses functional pathology testing and environmental assessments to ensure her clients get the correct medical diagnosis. And Alex and I discussed that diagnosis sort of criteria within our conversation today too. This is key in her treatment plans that include advice around therapeutic dietary strategies, lifestyle advice, and nutritional supplementation. Outside of her clinic, Alex is a passionate advocate for her industry and supports lobbying activities through her work at the Australian Traditional Medicine Society, ATMS. Here, she also runs Australia's largest continuing professional education program for fellow practitioners who, like her, want to stay on top of the science. She is a wealth of information, Alex, and you can absolutely hear that throughout our conversation today. And you can touch base with Alex through her website, alexandramiddleton.com.au, and over on Instagram at AlexMNutrition, both of which we have included in the show notes. Before we kick off into the interview, I'd just like to announce that actually, come 2023, Mikkipedia is going to have some mini Monday Mikki episodes where I spend 15 to 20 minutes either speaking short course conversations with experts around a range of topics or just sharing practical nutrition tips, because actually that's what a lot of you follow me for. So in an effort to just provide more value and more quality information, we are going to start releasing these short form episodes in January 2023. So absolutely look out for them. Until then, of course, the best way you can support the podcast is to subscribe at your favourite podcast platform where you listen to Mikkipedia. That way, more people are able to discover and connect with the experts that I interview. So that would be amazing if you were to do that. Thank you so much. Alex Middleton, naturopath and nutritionist. Thank you so much for joining me today to chat about particularly endometriosis, which I know is your where you spend a lot of your time. But of course, you also talk about gut health and hormone health in general. So I'm really looking forward to this conversation. Can we kick off by getting you to tell us a little bit about your background, how you got into the field of naturopathy, but particularly endometriosis as well?
Okay, great. So I originally got into natural medicine. I'm the daughter of a national champion swimmer from the 60s, and even way back then they were shoving supplements down their throats. So I've grown up with it. And by the time I hit 22, I had endo, and for 10 years got gaslit by doctors, and basically went on my own journey just trying to find out what would help me get symptom relief. And so I eventually met a nutritionist in a park who introduced me to the world of naturopathic nutrition, and ended up leaving financial services to do what I'm doing now. And I suppose I generally, see women with all sorts of reproductive and hormone issues, but endo I think I see a lot of because it's basically been a big part of my own journey. And I do know how you can get better from my personal experience. So I just try to help women that way.
Okay. And of course, we're going to go into, what is endometriosis, what are the symptoms, and what are some of the, obviously, the solutions to help women. But I do want to pick up on what you just said, that, you spent 10 years with endometriosis, yet it wasn't recognised by the medical profession. What is it about endo that means that it is either misdiagnosed or missed? Because I hear this a lot.
Yeah. So I suppose I'd preface it with saying the diagnosis is better than it's ever been. Back in the 40s, I'm sure my maternal grandmother had it. She had similar issues, and they used to call it guitar of the womb, which means stickiness of the womb. And the treatment for that was electric shock therapy to the head to get to reduce pain and get cycles going again. So I think the diagnosis is getting better. I think the issue is, two or threefold. The biggest thing is there's a massive disconnect between what information is available to us in the research and what mainstream medicine is aware of. There is some stuff that doctors are aware of, which isn't, like screening for particular infections, for example, that might be contributing, which isn't written into the national guidelines, so they're not necessarily screening for it. And I think the third part, just from my own personal experience, I work a lot with the medical community, but I come from a family of GPs. GPs, they're expected to know everything.
Yes.
And they're, whereas the Japanese master of all trades, whatever that expression is, and they spend 15 minutes with each client, and they're incredibly time poor. And the time that they have is at lunchtime for 10 minutes is generally spent with a pharmaceutical rep. So I just think the information, they don't have the time or the brain space to get all the information. And historically, especially in Australia and all the Western world, endometriosis, considered a women's health issue, hasn't been given a lot of research funding. We, thanks to Endometriosis Australia and some other advocates, we did get 50 million plus. So that's all been dispersed throughout research over the last 3 or 4 months. So there hasn't been a lot of funding either. But yeah, there's just generally a lack of diagnosis. And the other thing is doctors have generally, that's very generally speaking, told women that, painful, heavy periods are normal, where they're not normal, they're common. And there's a difference between normal and common. And if you have, if you're healthy, you shouldn't be getting, any endometriosis symptoms or any sort of period-related symptoms. It should be just coming and going.
Yeah.
That's just not the common thing these days.
Alex, when I chat to women who are my age in their sort of mid-40s, like I still talk to women who have, they're sort of beyond their reproductive years in light of them wanting to have children. They're still, within the scope of being reproductive, but they're not, not wanting to have children or anything like that. And they are now having sort of symptoms around endo, which they might not have either been diagnosed or been aware of when they were earlier, but I imagine that they would have been present sort of earlier. And I just so can we actually, first maybe can we kick off with you just telling us what is endometriosis and how is it diagnosed?
Okay, so endometriosis, otherwise referred to as endo by the endo world, So it's a condition where cells that are similar to that line the uterus, which is called the endometrium, they grow in other parts of the body. And what happens is, with the hormone fluctuations that come along at puberty, that go up and down, that tissue swells like it would in your womb and goes on to cause things like, pain, fatigue, infertility, and other symptoms. And so it's that endometrial tissue outside that goes wandering in the other parts of the body that's known as, what surgeons will refer to as lesions or implants. They're the things that are causing the problem. And they can be, big like a small apple, and they can be the size of a pinhead, which is why it's not always caught. And in terms of diagnosis, there's a bit more discussion happening around this at the moment, but the gold standard is a laparoscopy. So that's, keyhole surgery where they're, having a look in to see what they can find. But really, there are, certain blood biomarkers you can get GPs to screen for, and comorbidities to screen for too. And also a very particular type of ultrasound, which isn't done well by the mainstream. In Sydney, where I live, for example, there's really only one chain of ultrasound care clinics that, they're women focused. They know exactly. So the scan's called a deep endometrial scan, and it's done at a particular time of the cycle. It's done with an empty bowel, and it's internal. And the reason for the empty bowel is so they can, check for deep infiltrating endometriosis, which is where endometriosis is so severe that it grows in and around other organs of the body. But the bowel is a particularly common one. But you've also got superficial endometriosis, which is the most common form. It's about 70% of all endo cases. And then ovarian endometriosis, which also known as endometriomas. They're like these little chocolate liquid-filled cysts in the ovaries, and they can sit there and cause severe pain too. The gold standard is surgery, but the problem with, just having surgery as for diagnosis is just the act of cutting into skin or tissue. You run the risk of creating scar tissue, right, which can form adhesions, which can then, contribute to all the other endo symptoms. And so it becomes this chicken and egg cycle. And surgery definitely has its place. It's just a matter, about being smart about it with timing and things like that. So a lot of surgeons in Australia, for example, they're really pushing back on surgery to a lot of women that I see who are between 20 and 35, saying try anything else but surgery, because they know that you can get into this loop of surgery for pain relief, and that can cause other issues later, like, issues with implanting an egg and infertility and things like that. So, I'm hoping it's going to change and progress a bit more with some more cash behind us, but we'll see.
Okay, interesting. And so you mentioned the presence of lesions, and that they can be of varying size, and that so is it the lesions themselves that cause the issue, or is it some sort of reaction or something that occurs that makes them flare up or something like that?
It depends what you mean by issue. If you're talking about the pain and the fatigue and that big inflammatory sort of picture, it's the swelling of the lesions that are following the up and downs of estrogen and progesterone. And they can cause pain, particularly, if there's neurals and nerve involvement, where nerves either grow in or around those lesions. That can cause a lot of different pain, particularly pain with the duodenal nerve and the sciatic nerve as well. But that's generally what causes pain. But, 25% of women, or 20 to 25% in this country, don't have any symptoms, especially pain, and can be absolutely riddled with it. And those are the women that generally they either find out when they go to have a baby, and, they try everything. Very often they go through their GP without screening them for endo properly, keeping in mind that infertility is number 3 in terms of symptoms for endo. They don't screen them for endo properly. They send them off to an IVF clinic where they're put through repeated cycles of fertility treatments. And those fertility drugs, particularly the ones used for egg collection, are estrogenic in nature, which means ultimately they're going to, you run a very high risk of making the endo worse. And so those women will, as a last resort, often then be recommended by the fertility specialist to have a laparoscopy, to have a look. And then they look, and the woman's, riddled with endo, never knew it. They excise, which means to carefully cut away the endo, remove it, and they either go on to then have successful fertility treatments and sometimes even get pregnant on their own. It was just the endo getting in the way.
Yeah.
So yeah, the importance, especially at that GP level, it's getting better.
Yeah.
But the symptoms themselves, I mean, endometriosis, in my view, after having had it for 30 years, I've had it really since I was 10, but I wasn't diagnosed until I was 20 and I'm now 42. It's really the manifestation of a whole lot of other things combined that are then manifesting as endometriosis. Now, doctors will, especially the last 20 years, they describe it as an inflammatory disease. Inflammation really is an endpoint symptom. It doesn't talk about what's causing that inflammation. They definitely talk about it as, there's a hormone component, particularly with estrogen driving the disease. But really, when you look at the research, there are so many other things that are just as important, which are driving it. I mean, the big thing, which is getting more and more research, is immune dysfunction, which you've probably heard of. Yeah. So, there's a dysfunction in the immune system. There's a big microbial, so bacterial component about it. There's a huge environmental component going on. In my opinion, it's not just a matter of too much estrogen with hormones. There's also a very big hormone depletion piece, because it's very rare for me to meet a woman with endo who isn't running low on stress hormones, like adrenal hormones, because she's been ongoingly stressed for a long time, which then lowers her progesterone, which then gives, increases the chance of the endo going up.
Yeah.
So chronic stress and trauma, past and present, has a huge part to play. And the environment, which is probably more than half of it, which we can talk about. So, chemicals, things like parabens, even like on the east coast of Australia with the rain the last year or two, the rise in mold in people's houses, and, these poisons that mold spores breathe out called mycotoxins. Many women with endo have a gene where, unlike a normal person that doesn't have that gene, they breathe in those poisons, but they can't breathe them out. They can't detox, which is a common theme for women generally with endo. And what that does is that stimulates a thing in the liver called aromatase to push estrogen up, which then can make endo worse. So these women who have that genetic predisposition, living in house with water damage, or even their cars, their office, whatever it is, all of a sudden their endo gets worse and they have no idea why. And it's because, they've got mold.
So, Alex, you mentioned the genetic predisposition as an element that places a woman at increased risk. What other factors might place a woman at increased risk of developing endo?
Well, when you say genetic, there's a very big familial component, but just keeping in mind that I think when people think of genetics, they think it's your destiny, and it's not a destiny. Genes are turned on and off all the time by the environment. And I meet women all the time where two women in the family have severe endo. Let's say two sisters have severe endo, but the third sister has no problems at all. And so it's very often about what's turning those genes on and off, and, coming back to that environmental piece. So what puts them at disposal of that? Trauma is probably the biggest thing that comes to mind. The research is catching up on that too. There's quite a bit of research around particularly sexual, physical and verbal trauma, particularly when they're young. But the highest risk factor actually for having endo is if your mother's mother had it.
Okay.
Yeah.
Yeah. Interesting, because I imagine that at this time of sort of endo and what we know about endo, we're probably not going to know whether our mother's mother had it, because back then that doesn't sound to me like there would have been a lot of knowledge around that stuff.
Well, I think it depends what generation we're talking. But if you start talking without using the word endometriosis, and your grandma, your mum's mum starts saying, "Oh, yeah, I used to get painful periods, and I had a bit of trouble getting pregnant," and that's how they used to really push through. And so if you get them talking about what their period history was like for them, you can start to kind of pick up on the nuances. And if any of your listeners think maybe, I have period problems, maybe I should get screened, I do have a guide on my website, and part of that guide shows you how to ask your family the right questions, so you can get a really good family history that you can then take to your GP.
Nice.
Yeah.
How young does this present in women?
It's getting younger and younger. It's also getting older and older.
Yeah, is it because of the increased sort of environmental exposures and things that you're talking about? Is that why it's the
Yeah, the research is inconclusive. That's my opinion is yes, because, so girls as young, I mean, the youngest I know is 8 and another that's 9.
Wow.
Has, yeah. So they're getting, and they're also getting their periods earlier, right? Which probably has a little bit to do with the stress and the amount of estrogenic sort of toxins in the environment. But so they're getting them earlier. And so what happens is, one of the theories about endometriosis is that an endometrial cell, when you're inside your mother's womb, rather than staying where it's meant to, goes wandering in other parts of the body and just hides there. And when you hit puberty, which, like I said, is getting younger and younger, you get this trigger of estrogen and progesterone, particularly estrogen, and that's when the symptoms start to, present themselves. So, yeah, young as 8. But also there are women who haven't had a period in years and have issues with, particularly things. People think straight away, it has to be pain, but a lot of women don't have pain. They just have really severe fatigue.
Yeah.
Or they might have IBS, or, they might have other sorts of pain syndromes. So there are definitely menopausal women that have it too, albeit, endo symptoms are not as severe when your hormones aren't going up and down.
Yeah. Okay.
So, yeah, definitely, 8's the youngest I've seen.
Yeah. Alex, can you just explain for the listeners why something like trauma could then have this subsequent flow-on effect for something like endo?
So just to preface it with, there's no research on this yet, but in my own research. So what happens is, if you go through chronic stress or chronic trauma, and trauma isn't just abuse, trauma can actually be things like neglect, or maybe your parents had to emotionally check out for some reason, whatever it is, that's really stressful to a little kid. And when a child, kids don't really know how to self-soothe. So their hormones, a hormone pattern that's getting set in their younger years, particularly just before puberty, rather than their stress hormones just going up and down a little bits like it should, the extremities, the amount of stress they feel at a young age is high. And so what happens is they start to burn through their stress hormones, like most of you would have heard of cortisol, which you need to run away from a lion or a tiger, but you also need to get out of bed. And they start to burn through those earlier and quicker. And why that's relevant to women with endo, apart from the overall inflammatory response stress has on the body, that burning through cortisol, what happens is eventually that leads to something called adrenal insufficiency, when you start to run low on your adrenal hormones, and that has a whole other subset of symptoms. But when that happens, your adrenal hormones essentially start to steal from your sex hormones like progesterone, which you need to, stay fertile, but you also need to keep endo at bay. It starts to steal the ingredients, so you can continue to run at those high levels of stress hormone. And so your progesterone slowly starts to go down and down and down. So a really common picture that I see is women that have had some sort of trauma, particularly when they were young, not always when they were young, but trauma, or just chronic stress, chronic work life stress, psychological stress, physiological stress, like loaded with infections that the doctors have missed. And very often they've got low progesterone, too much estrogen metabolites going on in the liver, which could be feeding the endo, and they're feeling really tired and flat because their adrenal hormones are running low as well. So that's a super common picture. So that's probably why, but that's only my theory.
Yeah, no, that makes perfect sense as you describe it. And so I'm just going to probably jump the gun a little bit and ask a really, I don't know, would progesterone help a woman with endo then? If
Absolutely. So the first thing, just to explain, what a lot of doctors, when they say they're offering something like progesterone, and sometimes they tell women that there's progesterone only oral contraceptive pills, they're actually talking about progestin, which is a synthetic hormone that actually acts more like testosterone in the body and definitely looks more like it under a microscope, and cause all sorts of side effects like depression, anxiety, and weight gain and acne and things like that. What I'm talking about is bioidentical progesterone, which is made from wild yams, and it was actually way back when a naturopathic remedy that you could definitely buy over the counter, especially in places like America. But now the pharmaceutical companies have jumped on because they realize how effective it is. It basically, bioidentical progesterone mimics mimics the shape and actions of your own progesterone. So the brand name is called Prometrium. Otherwise, doctors can get it compounded by compound pharmacists. And even if a woman isn't on a blood test, and bloods aren't really particularly, they're just giving you a bit of an idea, because all bloods are telling you is about your total progesterone. It's not telling you about how much of that progesterone is working. And women with endo are known to have a bit of what they call progesterone resistance. So it's hard to get progesterone into the cell to do what it needs to do. So even if your levels aren't low and you've got endo, yes, you're going to benefit, absolutely. And so I very regularly recommend that I'll write a letter to the GP for my clients and say, hey, would you consider giving them this dosage of progesterone for the second half of their cycle? And progesterone is really anti-inflammatory. You know, if you take it orally, it really helps with mood and sleep in particular. If they can insert it vaginally, which has even better access for pain relief and things like that. So yes, definitely. And there are, certain herbs like chaste tree, which some people know as Vitex, and that also can help your progesterone status.
Yeah. Oh, so interesting. And then actually that does lead me to wonder, how often a teenager is going to the doctor with heavy periods. Because I was actually just giving a talk at a school the other week and it came up. We were just talking about hormone health and we're talking about oral contraceptive pills. And one of the girls said, yeah, but I'm still having a period. And as we know, it's a withdrawal bleed, not a period. So, but of course, the conversation came about because I was saying, you may well have heavy periods and your doctor may give you this, but in fact, it's not necessarily helping the situation. Do you see that, Alex, in your work? Are teenagers being offered it? Why would the OCP effectively would shut down that heavy period?
Yeah.
Would that impact on endo that would stop that high estrogen from sort of feeding it, but it's not necessarily taking care of the problem, because at some point that teenager will come off the OCP. Yeah.
So the doctors give it, what they're doing is they're suppressing ovulation. They're essentially putting a woman into a state of menopause, which, is effective for those hormonal swings. So the symptoms aren't severe, but it definitely doesn't eliminate the endo that's already there. Whatever's there will sit there dormant. And, from my personal experience, I was one of those women who got put on the pill for a long time. And ultimately, particularly if you want to have babies later on, rather than working on suppressing or hiding symptoms, sometimes it's worth the short-term pain for the long-term gain. So, coming off the pill, which can sometimes be a little bit rocky for some people, but actually really start addressing the root causes of what manifested your unique endo presentation in the first place.
Yeah.
And that's the only thing that's going to give you long-term symptom relief. It's also the thing that at the same time is going to enhance your fertility and your general cycle of ovulation. And the longer someone ovulates in the studies, the longer they live.
Yeah.
And, that's important for women when you think of how many women have been on the pill the last 50 years. So, so the pill is used to suppress symptoms along with a lot of other drugs, but ultimately it's just putting off the inevitable. And, I think especially if women want to have babies.
Yeah. And before I move on to my next line of inquiry, Marine is another one I hear women go on for endo and for things. Is it working in much the same way that you've just described, or?
So the difference between the Mirena and the oral contraceptive pill is it's a lower dose of pure progestin and it's localized version. And listen, if you have to pick one form of pretty safe contraception for someone that has endo, it's probably a Mirena. But I would just say just a couple of things. Number one, if you're thinking about getting any sort of IUD or a Mirena and you haven't had a baby, insist that you're knocked out somehow when they put it in, because a lot of doctors aren't doing it, and it's very traumatic for women that haven't had a baby to have an IUD inserted. I hear that story all the time. The second thing is Mirenas with some women with endo can cause more problems than not. They can make periods even heavier and cause more pain. It just depends on the person. And then the third thing to consider again is, at the end of the day, it's still secreting progestin, which is a synthetic hormone, which comes with its own side effects. So if we're talking contraception, it's probably the safer one. But for me, I'm all about let's get to the root cause rather than trying to, manage symptoms. But for contraception, like real safety, it's probably that.
Okay, no, that's great. Thanks, Alex. And before we do get to some solutions which a woman can sort of look at to get to that root cause, I do want to just touch on a few things. And one of them are, the common comorbidities that present along with endo. And you mentioned how the bowel tissue is often can be wrapped up in that with the lesions, with the endo lesions. So gut health and gut related issues, is this one of the more common comorbidities? And
yeah, so first of all, what we were talking about before, deep infiltrating endo, that's when endo is wrapping itself or surrounding the outside of the bowel.
Okay.
What you're referring to, like IBS, which is technically a comorbidity of endo, that's inside the bowel, right? And so they're slightly different things. In terms of comorbidities, I mean, pretty much every autoimmune disease I can think of has been related to endo in some way in all the studies that I've read, particularly things like celiac disease, Hashimoto's thyroiditis, which is autoimmune low thyroid, even things like vulvodynia, hypermobility syndromes, right? So I've never met a woman with endo who isn't floppy, right, really bendy, and that can cause all sorts of issues with other referred pain like back, shoulder, neck pain as well. Cardiovascular disease, women with endo are at a much higher risk. Certain reproductive cancers, particularly ovarian. And even things like melanoma and sun damage. And, there's been I'm a really moly person, so I found it really interesting. There's quite a bit of research on, women with endo at a much higher predisposition of having a lot of moles. So there's a very, very long list of correlations.
Well, that's super interesting, Alex. And you also mentioned, of course, some of the things which worsen or sort of bring about the flare-ups of endo and the bacterial link. Can you just sort of talk to us a little bit about that, like what's going on?
Yeah. And this is pretty well researched now too. They call it bacterial contamination. Basically, what it describes is an overload of pathogenic, bad bacteria or neutral bacteria where there's too much of it starts to leak from the gut, and it leaks into the peritoneal cavity, which is the trunk, your trunk, right, where your reproductive organ sits, and it that way can flare and feed the endometriosis lesions. And so probably the first test I'm doing with women with endo is I'm doing, a private test on screening everything in their gut. Good, bad bacteria, viruses, worms, parasites, which isn't particularly researched, but easily over half of the women in Sydney I see with endo have some sort of parasite that's affecting things. And parasites release on a cyclical basis their own poisons, right, which can have the same sort of inflammatory effect. And so those sort of bugs absolutely need to be taken care of straight up. And sometimes natural medicines can help, and sometimes you need specialised antibiotics, at which point I work with a couple of specialists to do that. So bacterial contamination is a really big part of it. And what else so also with gynecological infections too, they tend to be more viral, but a lot of those aren't written into the guidelines either. So screening for those sort of infections is also super important, because a lot of them are related to the pathophysiology of endo, infertility, negative pregnancy outcomes, things like recurrent miscarriage and stuff like that too.
And I also read, I think, Alex, something you'd written about thinking twice before using tampons or a moon cup if you've got endo. Can you talk to us about that? Because that's news to me.
So first of all, most women who have actual endo symptoms, most of them will naturally not want to use tampons, which is a good thing, because tampons, the pressure they can create can increase your pain. Generally speaking, with tampons, so if you want to use a tampon, it needs to be organic, because the bleach and the other dioxins non-organic tampons are generally bleached in, are correlated in the studies to the development of endo. In terms of moon cup, so if you actually research the guidelines for a moon cup is meant to be, after it's been used, it's meant to be boiled for like 5 or 6 minutes at top temperature. and then cooled in a clean place and then reinserted to make sure, there are certain bacteria which can add to things like toxic shock syndrome, that can hang around if it's not cleaned properly. And I've never met a woman that uses a cup that had any awareness of how she's meant to clean it. Most women are just using a cup, giving it a wash under the sink and popping it back up. And, especially when you go back to thinking what we were talking about with this bacterial component with endo from the gut, it's not just in the gut, it's bacteria everywhere. And, you don't want to be adding bacteria, which could potentially be fueling the problem even more. So, yeah, the cups are a very bad idea, in my opinion, for everybody, unless they're, the guidelines are properly followed.
Yeah.
I understand the environmental aspect, but, yeah, buy some period pants.
Yes, I saw you recommend that, and that a lot less admin involved in period pants.
Yes. Yeah, absolutely.
Yeah. Alex, so you mentioned that you do this complete raft of sort of tests to test what's going on in the gut. Which tests do you use, if you don't mind sharing that? Just because I know there are a bunch of them out there that are user paid, so I'd love your recommendation.
A complete microbiome map, and I use a lab in Melbourne called Naturopath. There are lots of different labs that offer that test. And that test, if it's with the right lab, why I like it is it's quite comprehensive, and they do use the right technology, PCR, to check for infections, which most doctors are still not engaging, even though they were using it for COVID. So, a really common story with bugs, like a woman can go to Bali, Thailand, Fiji, India, which is common in Australia, go on holiday, pick up a bug, have traveller's diarrhea, maybe vomit. Take the GP, if they go to the GP, might give them an antibiotic called Flagyl, and it will subside symptoms for a while, but it never really gets rid of the bug. And they'll do a test, but a doctor will do a test called a culture, where they're kind of just looking for it under a microscope. And these bugs are 1,000 times smaller than a pinhead. You need to get the very tiny parts of it to be able to check if it's there. And so PCR technology is looking for parts as small as DNA fragmentation. And so it's really the only tech that you want to use to screen yourself, particularly for parasites. And so I'm always checking that. And obviously the cool thing about the microbiome map is it's telling me about, especially the balance of the bad bacteria, and that might help me use different sorts of natural medicines to approach it.
Yeah.
But, again, like the bloods, apart from the PCR piece with the infections, even the bacterial piece, it's the gut and testing, it's really dynamic. It's only just giving you a snapshot in time, and you kind of just have to work with that along with the woman's symptoms.
Yeah, no, that's great. And you mentioned Naturopath. Over here in New Zealand, it's NutriSearch, so they're sort of like sister companies, if you like. Yeah. So I know that it's also available here. So outside of that, what else would you test?
So the first thing I do is I try and work with their GP, which is always fun, getting them on side with a natural therapist, to get comprehensive blood work, because very often that's been missed. The complete microbiome map, like we said, at some point I'm always getting them to do a vaginal microbiome, which again is a vaginal swab they do at home. They pop it in the post and I get the results later to check for infections like genital mycoplasmas and bacterial vaginosis. And it tells me a lot about their good stuff, their healthy vaginal lactobacilli, which are absolutely crucial to having healthy levels in order to keep things in check. And I don't think I've ever seen a woman with endo with healthy lactobacilli levels. And so I can use that to work with them with things like vaginal pre and probiotics and, other tools in my natural medicine box. So, and then there are other functional tests, checking someone's methylation profile. So how well this little process of methylation, which is the metabolism that goes on inside of every single cell that's responsible for things like your brain chemicals, the formation of your immune cells, your ability to detox and your energy. And that can get affected by stress and genetics as well. And everybody's got a unique profile. And that's really easily treated as well with supplements. And other things, checking someone's histamine is a huge thing with women with endo, usually super high, and often missed. So, there's a plethora of tests. It really depends on the person. I have a woman with endo that comes to me with a mouthful of amalgam fillings. We're working on that, and I'm doing pre and post tests, before the fillings are taken out and after the fillings are taken out, and we've done some detox. some women might present like they really have quite severe mold illness or what's called SIRS, chronic inflammatory response syndrome, which is definitely getting worse in this country with the rain. In that case, I might be, first of all, referring them to a building biologist to get their house or their working environment or car tested and assessed, but also doing, certain urine profiles to see where they're at, so I can measure at the beginning and measure at the end, just to make sure that everything we're doing is actually working. So there's about 100 tests, but they're probably the ones I use the most.
Yeah, and it's such a raft of tests, Alex, and it's not cheap either. And I don't know what it's like. And I assume Australia and New Zealand are actually quite similar. Like, of course, you can get your bloods done at the doctor by paying a GP thing, but otherwise it's user pays. Do you feel that, like, you must have clients who come to you who, like, that's just outside of their means, and so does that change, or are you pretty confident with the things which we will talk about soon as to how to sort of maybe go about improving symptoms? Like, are you still likely to see success doing the things that you might do outside of the test?
First of all, I have this conversation. I had this last night over dinner. Even without everything I've talked to you about today, the average woman with endo in Australia is spending 20 grand out of pocket on the disease.
Amazing.
And so to do this sort of deep work, you do need some disposable income. There are certain tests, so the parasite test, for example, if someone can't afford the microbiome app, which is, last time I checked, $370 Australian, which is a lot, I might, if they really can't afford it, what I might do is I'll write back to the GP saying, listen, I know about this other mainstream lab in Sydney. I know that they can do PCR in a stool. Can you arrange it? And that might cost $50. And at least then I've got the parasites covered. The top 10. So there are certain things you can get around. Sometimes you can just, get a good idea from symptoms and, naturally treat stuff. But the thing is, sometimes you need, a lot of the time you need like bioidentical hormones or antibiotics, whatever it is. Sometimes you need stuff from the medical community that's prescription. And to get that, you really need evidence to show the doctor. And because the doctors aren't across endo, let alone all these other tests, it really needs, a piece of paper to go to them with, say, look at this result. Here's the justification. Can you please give me this? But there are ways of getting around it. My dream is that everything's mainstream and complementary medicine start to merge a bit more. Yeah.
Totally appreciate. And so, a woman might go and get surgery. Does that just keep symptoms at bay? Does the endo sort of tissue flare up again? Do they need to think about the other aspects that we'll go on to talk to that can improve? Like, does surgery fix it all, basically, is what I'm asking?
Surgery, for someone with severe symptoms and severe endo, if it's ovarian or deep infiltrating endo, which is like 30 to 40% of the cases, last time I read, they will get good relief from surgery. And it depends on what was driving it in the first place. Sometimes it can be relief for a year, sometimes it could be for 4. Those with superficial or what they call peritoneal endometriosis, the latest research says that surgery actually doesn't help that endo very much. And so those women, they all think surgery is the answer, but actually the research shows it's actually not going to help you too much. It does give you relief. It definitely gives you pain relief, but ultimately it's going to come back if the things that caused it in the first place haven't been addressed. And I suppose that's why I went down the naturopathic medicine road, having come from a family of very traditional doctors. The biggest thing that I love about naturopathic medicine is we look for the root cause and we treat the body as a whole rather than compartmentalizing the body like conventional medicine does. That way of treating is just so limited because it's just not how the body works. And so, the endo will, if everything that was driving the endo is still around, it's going to come back. Yeah. Okay.
So can we now then, Alex, talk about some of the lifestyle things which could help improve a woman's endo? And I know that some of them will be sort of, will just confirm what you've talked about with environmental exposures and stuff like that. But, what are some of the real sort of game changers first when it comes to sort of lifestyle and diet?
I want to preface it with I'm a naturopathic nutritionist, and one of the most regular things I tell women that I see that they're surprised to hear is diet really is the tip of the iceberg. We can use dietary strategies to radically reduce endo symptoms. We can use dietary inclusions to help, feed things like a microbiome, your gut microbiome, which could then help improve your immune system, for example. But ultimately, if your body is relieved of all the stress that's causing all of the issues, bodies are meant to be resilient. They're meant to be able to, eat healthy most of the time, then go out and relax and have a glass of wine and whatever it is you want to eat. It's just while you're in this kind of acute symptom phase that we use diet. And so a lot of women have heard about gluten, and gluten, even if you're not having an immune response, whether it's an intolerance or celiac disease, gluten is very inflammatory, just generally speaking. And different women have different, some women with endo aren't triggered by gluten at all. But it is generally a better idea to keep your intake low. Dairy just generally is bad for periods, or for women with period symptoms for 100 different reasons. A lot of women think it's the lactose, which is the sugar component of dairy, but it's actually the casein, which is the protein component. And the cows in New Zealand and Australia and South Africa and England and America produce this very, inflammatory form of casein, which, can go on to make period symptoms worse. And so that's why you'll hear like a lot of women with any sort of issue, actually even IBS, they'll go to France or Italy where they're different types of Jersey cows and their wheat fields aren't sprayed with glyphosate or pesticides. And all of a sudden they're eating what they want and they're not getting symptoms. So yeah, casein in the dairy, and then probably, now things like alcohol and caffeine, any sort of stimulant, it's kind of a given. They're just going to fuel things like estrogen, deplete hormones that keep the endo at bay. But the biggest food group I think that's under-recognised, definitely under-researched, is this food group called biological amines. And one of the big biological amines is called histamine, which most people think they hear histamine, they think hay fever. But, histamine is this compound in your body that plays a really important part in your immune process, but sometimes, particularly in women with endo, is dysregulated. And what happens is these cells inside your body called mast cells, they release histamine, and one of the things histamine does is it can, especially in higher levels, is it can upregulate estrogen, which can then go on to feed endo lesions, and then that high estrogen state actually, chicken and egg, stimulates these mast cells to release more histamine. And so one of the ways that you can reduce your levels of histamine, and high histamine, symptoms are things like pain, fatigue, grinding and clenching, anxiety, depression, restless leg, insomnia, a lot of the stuff that women with endo and other people are going through. And you can measure your histamine, again, through a private test. So one of the ways you can limit it is through diet, either through foods that are really high in histamine or foods that liberate histamine in the gut. And at the top of that is anything fermented or aged. So all these like fermented foods and probiotic drinks and kombuchas and kefirs and even things like vinegar that women have been, apple cider vinegar and water in the morning is really good for your stomach acid. And these things that the mainstream media are telling all women this is great for your health. There's no one food group that's good and bad for anyone. It's highly individualized. And for women with endo, anything aged, anything moldy, like I said to you, anything fermented, but even natural foods that are high in histamine, including things like banana and avocado and dried fruit and baby spinach and eggplant and mushrooms. A lot of women with endo can get quite a bit of relief by coming off this big food group quite strictly. And what I tend to do is I get them to come off it strictly for 8 weeks, and then very slowly we just try one thing at a time. And a lot of women can't tolerate a whole avocado, but they could have a quarter of an avocado before getting a symptom. So it's a matter of playing with it, because you don't want to be living with this hugely restricted diet your whole life. That's no fun. So it's just about learning about your triggers. So for me, for example, white vinegar, which is used all the time in bone broth, which is also marketed as a health solution, worst thing ever for pain. Some people, so people learn about their different triggers, but it's generally those higher amine fermented sort of foods.
I have to say, Alex, as you were describing the, foods that were either liberating histamine or high in histamine, in my head, I'm like, oh my God, what is there left to eat? You must get that a bit.
So I've made an art form of developing recipes about that if anyone's interested.
Yes.
And that's why you don't want to do it long term. I mean, and listen, some people feel so good that they do it long term, or they do it every day of the week, but then on the Saturday night they go out and they don't worry about it and they get a few symptoms and they accept that that's just part of their experience with wine and pasta. So it is about balance and knowing it's in. But women who are really severe sometimes stay off them altogether for a while, and it's just up to the person and their mental load as well. But that's highly individualized.
Yeah. So, Alex, outside of the diet stuff, any supplements in particular that are not blanket, but that you might recommend to 90% of the women who come in to see you with endo?
Yes. So my favorite is probably liposomal glutathione. So glutathione is the natural compound that all bodies produce in their liver that helps you detoxify from everything. And everybody, as you get older, you start to run lower and lower in glutathione. But women in particular with endo, they really need that extra boost. Women with endo generally are bad detoxifiers across the board. And so, that glutathione support can help with detoxification, and therefore the symptoms will reduce and energy and clarity of mind goes up. My favorite for soaking up that old estrogen that can cause a problem is a supplement called calcium deglucarate. A lot of these supplements are prescription only, so you have to talk to a natural health therapist about it. I use a ton of quercetin, especially for that histamine response. I use a lot of ubiquinol, and there's ubiquinol and ubiquinol in terms of quality, and ubiquinol really is essential for healthy ovulation and mitochondrial health, so it really helps with energy and stuff too, and inflammation. It's like the master antioxidant. My favorite for inflammation is probably curcumin. And so curcumin is the potent extract of turmeric that they put in a cap. Also varies between the brands in terms of how effective they are. Super anti-inflammatory, great for the microbiome. It's really warming, so it's really great for like pelvic congestion and thick, cluggy blood, which a lot of women with endo always have in the pelvis. And then proteolytic enzymes is probably the other one. And proteolytic enzymes work especially if they're taken on an empty stomach, they can work to break down things like old scar tissue and adhesions.
Yeah.
But I mean, the women, it depends what we're looking at. You kind of got to segment what you're looking at so people don't get overwhelmed, and all the B vitamins, of course, as well. And it depends what the test results are and the blood's real and everything else. So, yeah, it's individualized, but they're some of my favorite. Okay,
lovely. And I did see that you wrote something to be mindful about with iron deficiency and iron anemia, and that a supplement isn't necessarily a good idea. Can you just describe just that relationship there and what your recommendation is?
Yeah. So the backstory is I went down this rabbit hole for which there is a ton of research, after having 2 bad experiences myself, after iron infusions, needing to call an ambulance. So what happens is with GPs, they look at, iron panels in the blood. And don't forget, that iron that's been measured, particularly the ferritin, it's only telling you about 30% of the iron stored in your body, right? Not telling you about the rest. And if you read the research with endometriosis is actually a disease of iron overload, but in the tissues where they can't measure it. And iron by nature is a pro-oxidant, the opposite of antioxidant. So what that means is it's inflammatory. It's going to inflame things that are already inflamed. It's in the research, it's very well documented to feed things like, bad bacteria, which in itself can contribute to these kind of anemic states on blood tests. So a woman can be loaded with bacteria. She can be eating meat and doing all the right things, but she's still anemic. Maybe she's got an infection that's just chomping away, or maybe her small intestine isn't absorbing it very well. And so many of the genes that control the expression of endo are regulated by iron as well. So you kind of got to watch that. And the dysregulated immune system with endo impacts the way that iron's metabolized in the body, which leads to increased oxidative stress, and then the lesions get bigger, and then there's more overload in the tissues and more bleeding, etc. And so what very regularly happens, it's not hugely talked about, especially in the medical world, is that doctors will see someone who's anemic, send them off for an iron transfusion, and these women have, it's funny hearing nurses and doctors describe it, they call it an allergic reaction or an anaphylactic reaction, and actually what's happened is not an allergic reaction, it's this severe inflammatory reaction, a cytokine storm. And women's symptoms can be flared for weeks. Sometimes their periods can get delayed. I hear about those stories every week. It's my dream to go and do a PhD on this subject, because the research, anyone can go onto PubMed and just type in iron dysregulation endometriosis, or just iron and endometriosis, and you'll see. The information is there, but again, going back to what we originally talked about, there's this disconnect between what doctors know and what's in the research. So yeah, iron supplements, I actually very rarely give iron supplements to anyone unless maybe they're pregnant. It's probably the exception. But,
okay.
Yeah.
So interesting. Yeah. And Alex, your obviously that's the diet side of things. Do you know what I always worry isn't the right word, but I'm mindful of things around like a moldy house or a moldy office or a job that is really stressful. Like these things really contribute to our sort of health status, yet oftentimes there's not a lot that someone can do about these big things. Like, so how do you approach that in your clinic, in your practice?
So my philosophy is the number one most important thing about everything that they find out that's driving their endo symptoms, that they don't get stressed about it. And if they feel like it's going to be stressful, what I learned in a meditation class once upon a time is that they intelligently forget about it. Women can only do the best they can. You know, modern day life, particularly in the cities, is already stressful, particularly women who are working with children. You just got to do your best. You know, and there are always small tweaks that you can do. So you talked about mold, for example. That's a huge deal, particularly if you own a house, it's expensive to fix. If you don't own, you know, the tenant protection laws don't exist in this country. The government recognises the problem, but they've done nothing about it, particularly for tenants. And so landlords don't have to do much to fix the problem. So there's only so much a renter can do to kind of modify their environment. And building biologists, who I generally refer to, they're also expensive. So because I've kind of been through all this myself, I'm pretty experienced in guiding people what they can do and how they can make small changes that could possibly, you know, be helping them. It's just about ticking, you know, slowly little things off the list, even things like, you know, if we're talking environment, like swapping your toilet paper from a bleached toilet paper to an unbleached toilet paper, swapping your toothpaste from a fluoridated toothpaste to a non-fluoridated toothpaste, swapping your tampons like we talked about before. All these just like little things that won't affect their costs. It's just a matter of making a swap and making a better choice that will ease the body and therefore potentially ease symptoms.
Yeah, no,
but stress is the big one here.
Yeah, that's great advice. And I imagine that because of what you just said with stress being a major player, that in addition to the diet and what they can do in their lifestyle, stress management must play a big role in helping these women sort of navigate their way out.
Yeah, it's absolutely massive. And, you know, don't forget stress when we're talking about how stress affects the body, we're not just talking about stress in present time. You know, stress that affected you when you were young or whenever in the past, if it hasn't been dealt with, it's still sitting there in your cells. And really you need a skilled psychotherapist, somatic psychotherapist, kinesiologist, you know, someone who you can work with on a regular basis to really start to clear that stuff from the subconscious mind. Because if your subconscious mind's loaded with trauma that you're not even aware of, just that alone could be driving stuff. And so that's a really huge part of it too. And so, you know, these women with endo, it's huge. It's not just endo they're dealing with. They're very often dealing with a parasite, a moldy house, hypothyroidism that's been missed by their doctor, et cetera, and they have to kind of slowly address them one by one. And I'm lucky because I've got a good network of doctors in Sydney, and so I know who to send them to, because not all doctors are as good as them, unfortunately.
Yeah, no, that makes perfect sense. And I also imagine that a lot of women with endo, not only do they have a lot of what you've just described, but potentially in their everyday life, they may have children and high stress jobs and all these other things which will just add to that burden that they then will be contributing to the disease process, I imagine.
Yeah. I mean, if you don't see a practitioner like me, my number one piece of advice is look for ways that you can manage your stress. You know, people talk about meditation. That's great for some people. Some people just need to go float in the ocean. Some people need to just hang out and hug their dog. Whatever it is for you, find it something you can do every day, and then find a technique that you can use that when you start to feel that stress feeling, you can use to pull yourself out of that quickly, because it's that sucking the air and stress feeling, that's what's going to cause distress in your body. So learning how to manage that is really important too.
Yeah, that is such good advice. And my one of my good friends, Cliff, who Cliff Harvey, he was the one, I remember him saying that for the first time as well. It's not necessarily the meditation itself that's important, it's the outcome. And we can get to that outcome through doing something, as you said, that just helps alleviate that. That's great, Alex.
Yeah, and I will add, there are other things, like if you're even so time poor and wound up that you can't even get to that point, there are certain natural medicines, for example, a good example is ashwagandha, which can literally de-stress you, amongst other benefits. So, yeah, there are lots of different ways.
You're such a wealth of information. I've learnt so much from both having a look at, doing some background research for our interview, but even just talking to you now, this just feels like such a minefield. So I can imagine that someone who's experiencing this or suspects that they might feel just not overwhelmed, or maybe overwhelmed by everything that we've talked about. Obviously, you see clients. Can you give us some information on the resources that you mentioned? Like, where would we find these? And if you do work sort of just online or just in person, where can we find you and all of your information?
Yeah, so my website's alexandramiddleton.com.au. On the homepage, I do have a free guide to women who think they have endo symptoms and how to get diagnosed, and that's quite detailed. Teaches you how to talk to the doctor and actually to get the diagnosis, which is super important. I also run a Conquer Endo Naturally program, so it's an initial 5-month program. A lot of women just keep renewing it with me. And I developed the program. It doesn't actually differ from what I do every day with one-on-ones, but it's a good way to get more resources from me, more time on email, and it holds you more accountable. And it's also subsidised, going back to the cost of having endo, which can help a lot of women too. My Instagram is AlexMNutrition. I post a lot of good free information on there, and feel free to send me a message anytime you get stuck. I love answering questions. And that's really it. Anytime, just throw me an email or a message.
Alex, thank you so much. This has been great. And we will put links to your social media handles and, of course, your website in the show notes. Yeah, this has been great. Thanks so much for coming on the show. I really appreciate it.
Thanks for having me.
All right, team, hopefully you enjoyed that, and absolutely share this episode with anyone that you feel would really benefit from the information that Alex has provided us. That would be amazing. Next week on the podcast, I'm super stoked to bring to you the conversation that I have with Alan Aragon, who is an absolute guru in this nutrition space. I have been following him basically forever. Until then, though, you can catch me over on Facebook at Mikki Williden Nutrition, on Instagram and Twitter at Mikki Williden, or head to my website, mikkiwilliden.com, where in addition to signing up to my weekly email or my recipe portal access for just $12 a month, you can book a one-on-one consult with me. Until next week, team, have a great week. See you then.